Hello, this is Dr. Stanley Lang, and welcome to this broadcast. I have a question for you today. What do you think is the most common vitamin deficiency that is going on in the United States today? And what do you think is the second most common? So I'll give you a moment, and then I'll come up with the answer for you. First of all, vitamin D deficiency is the most common. It's clearly epidemic. I would say well over 90% of the patients that I test are significantly vitamin D deficient. The second question, though, is more of a trick question, which is, what's the second most common deficiency? And the answer is, we don't know, because we don't do enough testing. And partly because we really don't have the technology to test all of the vitamins very easily. So in most cases, we don't really know. But I can tell you the second most common one that I come across, and that's vitamin B12. So vitamin B12 is increasingly interesting vitamin because so much fascinating research is being done on it and brain health. Now, as you know, I approach health in a body, mind, spirit approach. We call this a whole person health approach. And today we're focusing obviously on the physical part of this triad, but I do want to give mention of the importance of emotional health, making sure that you're dealing with chronic stress reduction on a daily basis, and the importance of spiritual health. If you want to be really well, you have to attend to the spiritual needs that your person has, and your body functions better when you are in good spiritual health because your stress is markedly reduced. But if you're deficient in key vitamins, your body doesn't function well, you don't feel well emotionally, and it's hard to attend to the spiritual life if that's a priority for you. So that's why all three intersect in the pursuit and the experience of good health. So vitamin B12 deficiency is happening more and more for several reasons. One of the reasons is that people are taking acid-suppressing drugs more than ever before. And these acid-suppressing drugs, I won't give you the name brands, but they're all over television, have an effect in the stomach that essentially markedly diminishes the bioavailability of the vitamin B12 that is either in your food or in any supplements you're taking. So without that acid some of the conversion doesn't happen in the stomach, that has to happen for it to be absorbed well. So B12 deficiency is very, very commonly increasing because of all of the acid-suppressing drugs that people are taking. Now, a lot of people don't eat vitamin B12 rich foods, and there's a lot of confusion about whether you can get vitamin B12 from vegetables, and the answer is not nearly like from meat. So vegetarians don't like to hear this because they have been taught that there's plenty of vitamin B12 in the vegetables. Well, the answer is actually these are called cobalamins, so they are vitamin B12 lookalikes, and on a blood test it may look like you have enough vitamin B12, but if it's all coming from a vegetable source, it's likely not biologically active. Now, one of the problems in the United States is that our norms for what is the lower level of B12 are not the same as around the world, and that produces quite a bit of confusion. In some parts of the world, what we would call normal would be considered seriously deficient. And in the United States, the norm was developed a long time ago, and it's pretty much based on severe B12 deficiency, where you start to get significant damage to nerves and things like that, where other parts of the world start to call something called B12 abnormal when you start to get more subtle symptoms of B12 deficiency. And so I see a lot of people who are in this in-between range. They're above what would be considered normal by US standards, but below what would be considered abnormal by many other countries' standards. And I find that people that are in this middle range respond dramatically to significant B12 supplementation. Their energy levels are much higher, I would say more than 90% of the time, if they push their B12 levels up into the high normal range. Now you can do that very simply with simple B12 tablets that you can purchase over the counter, no prescription needed. And most people who are in this in-between range, they're not absorbing B12 normally, but it still works, their system still works well enough that they'll respond to big doses of oral supplementation. So in that instance, I tell people to take 2,000 or 3,000 extra micrograms per day. Now, there's a whole lot more that could be said about B12 supplementation. This is not intended to be a thorough discussion of it. I just wanted to alert you to it. And if you're feeling fatigued, you might be B12 deficient or a little deficient. And so B12 supplementation is totally innocuous, completely benign. You can't take too much of it, and it may help you. So if you're feeling a little tired, consider taking extra B12 for a while. I wish you well. God bless, and have a great day.